We're the All People's Health Collective, where organizers, advocates, and everyday people come together to demand care, housing, and freedom for all. APHC is fighting for care without control, housing without conditions, and dignity for every person.
Hey everyone, welcome to the All People's Health Collective podcast again. This is Susan, your host, and I'm joined today with Eric Harris from Disability Rights California. Super excited to have you on, Eric. To start, can you just introduce yourself and share a little bit for listeners about what brings you to this work?
Yeah, so hi everyone. Really excited to be here. My name's Eric Harris, and I'm at Disability Rights California. I'm based in Northern California. And what brings me to this work, I'm a disabled person. I'm a Black disabled man. And I've always been an advocate, grew up in a family of advocates, around advocates. And I've always felt it was my journey to be an advocate. So while I was in school and out in the community, I've always wanted to advocate for community and advocating for the disability community is something I'm very proud of.
Awesome. Well, it's great to have you here. And maybe just to get us started, can you just orient us in a sort of big picture way? What does the landscape of disability justice look like in California at the moment? What are you seeing? And kind of what are the challenges that you're facing at this juncture?
Yeah, so I would say, disability rights has always been a space where community of all types comes together. So, disability crosses over to race, gender, religion, location, all of those different things. So that's been something that I've always been really proud of, and I know many disability advocates have also been really proud of. But in this current moment, there are a number of challenges that our community is experiencing in California specifically and across the country. Of course, with the current federal administration, some of the challenges that they present in terms of not having disabled people in a position of power and often harming disabled people by taking away healthcare, taking away access to services, and using rhetoric that is very dangerous and harmful to disabled people, which often leads to more bad federal policy. So that's one kind of huge umbrella over all of this. And then in the state of California, now for years, it's not a new thing. The way that the state approaches folks who are unhoused, homeless, folks who have mental health disabilities, and other types of disabilities who live on the street, the way that the state has approached them and treats them is often with a carceral approach, and that carceral approach has crossed over into other spaces. Um, so I mentioned the federal government and the state government now are trying to be, and I use air quotes here, tougher on crime, and view being tough on crime as beneficial to everyone when we know that a lot of the systems that have been put in place have disproportionately impacted disabled people and especially Black and brown disabled people. So it's constantly a battle and it's constantly a space where disabled voices are necessary. And it's really unfortunate because, we should be coming together to do other types of advocacy, but we're constantly having to do advocacy for folks who are in carceral settings, are institutionalized, whether it be in immigration detention facilities, whether it be in mental health facilities, developmental centers, and on, jails, prisons, and I think, it's unfortunate that we still have to um, push so hard and advocate against all of these types of institutionalization because so many disabled leaders throughout history fought really hard to make sure we would not have to be in those institutions. But unfortunately, we are still in many institutions and having to fight to get out.
Absolutely. How has the state of California been responding to those federal budget cuts that you mentioned? And of course, there's also the issue of the governor's race, Governor Newsom going out to new candidates. I'm just wondering what the conversation about disability has looked like in this race, and where the candidates stand, if yeah, if they've been good on these issues.
Yeah. So, in general, we had the primary several weeks ago. Um, and in general, all of the candidates have been um, very lukewarm on disability at best. And I would even argue to say that they've been non-existent on cross disability issues. Some of them some of them spoke up about very specific types of disability. But when you talk about cross disability and the impact of disability and what the governor's role is, and has been on disability issues, there hasn't really been a leader up to this point that has um, one communicated directly with the disability community on the issues that we have prioritized. So we haven't been able to really engage, especially with the leading candidates. Now that we have two candidates in the running for governor in November, both of those candidates, Secretary Javier Becerra and Hilton, neither of them have met with the cross disability community to find out, what some of our priorities are, and that's going to be a real big, um, a top priority for us going forward. We really want to engage with those two candidates. We want to find out what their disability platform is, and we want to find out what they intend to do differently um, from what Governor Newsom has done over the last 8 years. And for us, a lot of that goes back to what I mentioned earlier about listening to the disability community first and understanding that, what we want and what we say is what we need. Nothing about us without us. And we shouldn't, be in situations once again with a new governor where there are several policies that go through, including, um, some of the policies that Governor Newsom had that are harmful to the disability community without any input from disabled leaders and people who have lived experience. So that's a message that we would want to send to whoever the next governor is, and we hope that we get that opportunity to deliver that message.
Absolutely. Yeah, that's obviously disappointing to hear, but never surprising that they haven't been great on these issues. And as you kind of mentioned earlier, talking about cross disability and how these systems of punishment, carcerality, institutionalization intersect. Can you just say a little more about how that plays out and what are kind of the specific traps that members of the disability community who are kind of at the intersections of these punitive systems are facing?
Yeah. I think about this often, but disabled people, if we start as like little kids, are treated differently. Disabled people in schools are often placed in segregated school settings right from the very beginning. If you have a learning disability, if you have a mental health disability, if you have any type of disability that so-called, traditional education systems are not, kind of prepared to work with, oftentimes those students will be placed in other classrooms or in separate settings. That's the kind of first step, and then often those students will get suspended or expelled, and it's often because of um, the old school systems that are in place. And as we know, most of those students are going to be Black and brown students who maybe didn't get diagnosed properly early as kids. Maybe they didn't have the health care that other students might have had, to be able to get the services that they need. But that's often like the kickoff point. Like that's often the first step for many um, kids with disabilities to start down the path of being disciplined or over disciplined, sometimes even arrested at schools. Um, and then, of course, becoming more difficult to graduate from high school, becoming more difficult to obtain meaningful, gainful employment. And then the cycle kind of continues, and folks, have challenges getting jobs, maintaining jobs, getting housing, maintaining housing, and then they get often caught up in these systems that we talked about earlier, whether it be jail, prison, incarceration, or other types of um, institutionalization and detentions. So these cycles often kind of continue, and most of the folks that we work with, most of the folks that we talk to who wind up on the street have been caught up in these systems and have been institutionalized or have been incarcerated, and have struggled, maintaining the services and support that they need, and then have had trouble staying out of these systems that we've been speaking about. So until some until leaders in the state and leaders in the country really take that seriously, we'll continue to have that cycle, and it's really unfortunate.
Yeah, it's really powerful, I think, to hear about that cycle and like how these material challenges compound and just how difficult it is to survive, like for anyone, but especially for folks with like the stripping back of healthcare, in California with this massive housing and cost of living crisis. Um, and since we're coming up on this, I know we're coming up on Disability Pride Month in July and the 36th anniversary, I believe, of the ADA. I'm wondering if you can reflect a little bit on the ADA, especially from a more economic perspective, kind of where has that worked to move the needle on economic conditions for disabled people, and where has it fallen short, and what are kind of the remaining gaps in areas like housing and employment, where we still have a lot of work left to do.
Yeah. So, the Americans with Disabilities Act, passed and signed in 1990, made a big difference for so many of us with disabilities. Many of us who were born either right before or right after the Americans with Disabilities Act being signed probably don't even think about it because we've just always had it. It's just always been a part of our lives. But talking to advocates and leaders who lived in the 70s and 80s through a lot of the challenges before the ADA, tell stories about how much their lives have been positively impacted by the Americans with Disabilities Act. So we're super grateful, and we wouldn't, be able to have many of the opportunities that we have if it weren't for the passing and signing of the ADA and all that the amazing, incredible advocates over decades to make sure that the ADA was passed and signed. So I'll start there. And then I'll mention, of course, that the opportunities that many folks have, especially in rural parts of the country, um, and the uh, and the accessibility tools that are available, especially in rural parts of the country, but all over there, are really beneficial to disabled people. With that said, though, I think that some of the challenges that still remain, even though that the ADA is the law, in order to enforce the ADA, you have to file lawsuits, which make it really challenging, especially for people who don't understand or know what their rights are under the Americans with Disabilities Act, or don't have access to a lawyer, don't know how to start that process. Like, that in and of itself is a big problem, and we really need stronger ADA enforcement. We need government enforcement, but we also need other tools for folks to be able to enforce their rights, their civil rights under the ADA. The ADA, continues to get updated, but I think that some of the challenges that often come up are some of the traps that lead to folks remaining in poverty. And so, some examples include like the work requirements that have been proposed in a number of states throughout the country, but they're often brought up during election times, and when certain parties feel like it makes sense uh, to bring them up. And I'll briefly just explain what a work requirement is. And of course, we understand that context when it's a work requirement for somebody to get funding from the government, like if it's a universal basic income with a work requirement. We kind of understand why that's so problematic, and why how that gets brought up. Work requirements for disabled people often comes up with Medicaid. So Medicaid being the federal or a federal tool for healthcare for folks who are disabled, relatively low income, and need some access to healthcare outside of their employment and otherwise. Um, the rhetoric around those work requirements for Medicaid is often that disabled people, or these people who are on Medicaid, are taking advantage of the system, and essentially that they should be working if they're going to get these services. The problem with that, first of all, it's a false premise. People who are on Medicaid, over 60% of them actually work, have some type of job, and many of those people have, minimum wage jobs. They're just getting by. They're working at restaurants, hotels, they're caregivers. They are really working kind of the like bare minimum I mean, they're working and getting the bare minimum in terms of payment, and not getting any health care for it. So having Medicaid for them is the matter of life and death. It's a matter of being able to get, your appointments, your medical appointments, your medications, etc. So that in and of itself kind of shows how ableist and racist and old school um, work requirements are for folks who are on Medicaid. So that kind of is like a whole can of worms that is a major problem. Um, but just in general, you know, folks with disabilities depend on a certain amount of services and supports to just be able to live. Um, and when we put limits on how much money low income disabled people can save while they're on some of these programs, it creates an environment where disabled people have to jump through additional hoops, and it makes it really challenging for all of us to navigate. I remember when I was on SSI as a young person, first, it's a lot of paperwork to even prove that you're disabled, which is ridiculous. And you have to prove that very often. It's a lot of kind of process stuff that makes going through it really challenging. And then after you go through it, you can only have a certain amount of money in your account at any given time. So an asset limit, I know, is a major issue throughout the country and has been a major issue here in California. And what most people just assume as what's the big deal if you're low income, you shouldn't have, and you're on these services. In order to be sure that you actually need the services, you shouldn't have a lot of money in your bank account. But it's just a ridiculous kind of concept and a ridiculous way of doing this because it keeps people who are already struggling and who often have to manage every dollar that they have anyways. um it disincentivizes them from saving. It disincentivizes them from being smart um about kind of how they keep their resources, where they, if they want to save money staying with family members or otherwise, like all of these things are basically, hurdles that they already have to jump through, and then you add to it that they can get their services taken away if they have too much money. So those are just a few of the many problems with the way our systems are currently set up.
Are those work requirements a part of just federal benefits that pe Californians receive, or are they a part of California state-specific programs as well?
So yeah, so right now, they're part of the federal approach, or at least they will be as a part of the Trump bill HR 1. Um, right now, several states throughout the country have tried this type of system for work requirements for healthcare. They consistently do not work. States in the Midwest, states in the South, including Arkansas, have tried work requirements and they haven't worked. Um, and in California, it's always a contentious issue. So it's one that the next governor is going to have to um, listen to the disability community about and know that this has been tried over years in different parts of the country and has not worked. Um, so we're hopeful that the next governor does not go in that direction.
Right. And I would imagine, I mean, these have been part of benefits programs since like the 80s or, with the rise of kind of austerity politics, and it's been shown over decades that it never works.
That's right.
Um, and as you're thinking about what's needed in California, kind of what are the frontiers of this fight now? And yeah, what does advocacy look like for you now?
Yeah, right now, so the top two or three things in California that we've been advocating on, number one has been healthcare fights, making sure that there are not budget cuts that impact disabled people's healthcare. And unfortunately, we've had to do this the last several years. It's not a new thing. Um, and we always get told that, the state doesn't have money or that the budget is being impacted. And we get told that no matter who the president is, frankly, and no matter what's going on in Washington. So, we understand that there was, HR 1, the new federal bill from last year that President Trump signed. But we get told this every year. It doesn't matter if there's a new bill. It doesn't matter if President Trump is in office. It doesn't matter, kind of what's happening. So to us, you know, we know that money's available somewhere, and it's about prioritizing the people who need it the most, and folks who depend on their in-home support services, for example, um, they don't have the luxury of choosing whether they have in-home support services or not. They need it. It's a literally a matter of being able to live independently, or not. So to us, it's about prioritizing. So that's one kind of big chunk issue. Mental health and homelessness is always going to be a top priority issue for the disability community across the board, and remains to be true. And we've talked about it before, but the carceral approach that the state has taken on mental health and homelessness is something that advocates with lived experience with mental health disabilities have consistently pushed back against. They have consistently said this is not the direction that they want. They don't want to be in institutions. And what our organization and our allies continue to do is lift up that voice and say, whether it's care court, whether it's the expansion of the definition of gravely disabled, whether it's Proposition 1, none of these systems have worked. And doubling down on them in the ways that the state has tried to do over several years is heading in the wrong direction. And we want that to be made clear. And we need to find leaders, both at the governor's level, but also in the legislature and at the mayor's level, leaders who are willing to push back against those types of policies, because disabled people have made it clear that's not what we want. That's not the direction that we want to head in. Um, and then just generally, the way that the state approaches the criminal legal system, how we overcriminalize in the state of California. Um, we the generally, the state uh, tries to lift up any opportunity that they can whenever they uh, close a prison, for example. But we know that there are so many institutions throughout the state. There are so many prisons and jails throughout the state that people are over criminalized all the time, especially in certain communities, in communities of color, in urban, urban communities where Black people and brown people live. Those communities are over criminalized, and the state is constantly like turning up that pressure and turning up that heat to criminalize even more, to make it easier to criminalize people. Um, and as disabled people, it's our role to make sure that disabled people who are in all spaces, including those who are part of the criminal legal system, part of the immigration detention centers and facilities, that all of those people have advocates. And so we've been, doing our best to be in all of those spaces. And the last thing I'll just mention, in the current environment with what's happening on immigration, we have an amazing investigations unit here at Disability Rights California. And one of the things that they are able to do is have access to all places where disabled people are likely to be, including immigration detention facilities. And they've done a number of amazing reports, including one in Adelanto immigration detention facility, and California City, down in Southern California. And in their report, they're very clear that disabled people who are in these spaces are being harmed, are being mistreated, do not have the services and support that they need, do not have the medical care that they need. And it's been consistent in their work. And so we're hopeful that the next leaders of California, or the current leaders of California, and the country do something about that, because We shouldn't have people in these settings, especially disabled people in these settings, being harmed in the ways that they are being harmed.
Yeah, we've talked a lot today about disability and immigration, disability and carcerality, disability and intersections with all of these issues. And coming from a background where I also work at a nonprofit that's historically in the criminal justice space. Um, and so we also face these sort of challenges with like historically nonprofits being incentivized to stick in one lane. And maybe in this particular moment, like philanthropy also, forcing people into like a very competitive mindset sometimes through scarcity of resources and funding. But just how difficult has it been to try to break those silos, and what has advocacy, like um, what has DRC been doing, I guess, as it's trying to break those silos and working to overcome
Yeah.
the narrowness of these different lanes that a lot of nonprofits are historically tied to.
Yeah, so I would start with, it isn't easy. It takes not just courage, but it takes you know, leadership from different levels of organizations to be able uh to recognize that we can't be in silos during this time, that we don't have the option. Um, and Disability Rights California is the largest disability rights organization in the country. And we recognize that what comes with that is the responsibility of advocating for all disabled people in all settings. And I think that uh, we recognize that it isn't easy for every organization to be able to do that and every leader to be able to do that, especially during these times where funding is being cut, um, uh, diversity, equity, inclusion, and access is being threatened, or taken away completely. Like these are all real things, and when you have organizations that really depend on funding from different spaces, like that's a real thing to worry about. What I would say though is, if not now, then when? And if not us, then who? Like we're kind of in this space where um if organizations like Disability Rights California, All People's Health Collective, and others aren't stepping up during these times when it's the most challenging and when people are really scared and people are being killed and harmed, um, I'd say we really have to check ourselves and look ourselves in the mirror. So um, so that's what I would say. I know that it's really difficult, and we try to align ourselves and support folks during these times who can use the help of a big organization like DRC. And we're really grateful that we have the incredible board of directors that we have at DRC. They provide the support and leadership in saying like, yeah, we want you guys to do the great work that you all do, represent our community, advocate with us and for us. And so it's been a really great journey, and I think that the staff, the leadership of the organization, the board, we're all on the same page that disabled people need uh, advocacy right now and in all spaces. So that forces us to get out of the silo of traditional disability, and make sure that we're in spaces where all disabled people are.
That's awesome. I feel like you kind of already answered my next and last question, but as I'm just reflecting on this very insightful conversation, and we're bringing this interview to a close, I'm just thinking about the different kinds of crises that we've talked about and that we're being forced to constantly respond to, and the sort of uncertainty around, the budget and funding and who's going to be in that governor's seat. Um, So just to close out, I wanted to ask, what do we stay locked in on in this moment, and what is the call to action for listeners today?
Yeah. So I would say first is, to recognize that we are not alone in these fights. Disability Rights California is really proud to be in the California Disability Leadership Alliance, which is a disability-led statewide group of cross-disability organizations. So you have mental health organizations aligned with blind organizations, aligned with um, physical disabilities, like all of us kind of being on the same page. And I think that's given our community a lot of hope in knowing that we're not in this by ourselves. And we can, make a difference. We can shift the direction of some of these arguments and the direction of some of the terrible policies that we've all seen. So I would just say, our call to action right now would be to align yourselves with other groups, other leaders, maybe some that are outside the box. Like I think instead of making sure that we're not just kind of in echo chambers talking to ourselves, but that we are expanding to other groups, other leaders, like-minded folks um, who are doing good work. Um, and then, it's the constant putting pressure on the decision makers, making sure they know that we are the ones whose voices and whose experiences they need to be listening to. And they need to make policies that we want and not the other way around, and then us reacting to bad policies that they put forward. So that's what I would say in terms of a call to action at this time.
Absolutely. Thank you so much, Eric. This has been really wonderful to talk to you and learn from you, and just a super insightful interview. Is there anything else that you want to make sure we get to, or that you want to put out there for listeners?
I would just say, wherever folks can, continue to uh, lift up all of our great work. Not just Disability Rights California, but like I said, the All People's Health Collective. And when you see folks doing good, uh, point that out. Obviously, we're going to call out and say when folks are doing wrong and folks are putting forward bad stuff. But I think when we find leaders and organizations that are doing the right things, it's important to lift that up as well. So it was really great to be here, and I'm just looking forward to continuing to work together.